Although most health regions in Canada have reported cases, this map showing the incidence rate per 100,000 population illustrates that some areas have experienced more activity than others. In particular, Quebec and Ontario have had some heavily affected areas, and considering their larger populations, these jurisdictions account for 86% of our cases overall. Currently, hotspots linger with persistent community transmission in and around Toronto and Montreal. So in looking at the boxes to the right, the lower box shows that the proportion of cases who died has remained at about 8%. This case fatality ratio changes over time as new cases and deaths are reported. Based on the available information, 15% of cases have required hospitalization, and just over 3% have required intensive care. These graphs showing that daily numbers of new cases and deaths on top, and the daily totals of hospitalized and critical case patients on the bottom. They all illustrate the steady decline in COVID-19 activity since the peak of the epidemic in late April. Monitoring these indicators tell us that our public health measures have been successful in slowing the transmission in the community, particularly as all four show a steady decline. Slide 5. Another indicator of epidemic control is the effective reproduction number, or RT. This number represents how many people are infected by each new case. In order for the epidemic to die out, RT needs to remain consistently below 1, meaning on average, each new case infects less than one other person. Nationally, the RT for Canada has been below 1 for more than 8 weeks. At this point, with transmission under control in jurisdictions across the country, fluctuations in RT at the national level, which you see in the sort of green shading if you have the graphs in front of you, are now a result of smaller numbers and localized outbreaks. So all age groups have been affected by this pandemic, although incidence among children and youth has remained relatively low throughout. On the left, the sharp peak in incidence among adults aged 80 years and older, which is the green line, is largely attributed to outbreaks in long-term care homes. As the epidemic has slowed, the incidence rates have steadily declined in all age groups, though the decline has been relatively slower in younger age groups. Because transmission rates are declining so steeply in the oldest age groups, individuals under the age of 40 now account for a greater proportion of total cases in recent weeks. The epidemiology of COVID-19 in Canada is a composite of different regional epidemics. This slide shows Canada's 3 largest outbreaks across the top. All have experienced significant community spread and daily cases into the hundreds, especially in Quebec and Ontario, and to a lesser extent, Alberta. The center row shows provinces with outbreaks and limited community transmission, with daily case counts remaining below 100, and transmission now largely brought under control. The lower row with daily case counts in the low double digits show provinces that experience isolated and largely contained outbreaks with minimal to no community transmission. Finally, the multiple distinct peaks in the curves along the right-hand side for Alberta, Saskatchewan, and New Brunswick serves as reminders that resurgence can happen in any place and at any time, even in areas with no or low levels of transmission. Prince Edward Island, the Yukon, and Northwest Territories have had no community transmission, while Nunavut had reported no cases to date. Current patterns of COVID-19 incidents, and this is in the past 14 days, show limited to no transmission in most areas of the country. But areas of increased incidence, shown as darker blue areas on the map, represent areas experiencing outbreaks, as seen in areas of Saskatchewan, and hotspots of persistent community transmission seen in and around Toronto and Montreal. COVID-19 has exploited social and economic vulnerabilities and inequalities across Canadian society, taking hold in settings and among communities that experience overcrowding, lower incomes, and health disparities. Long-term care and assisted living homes have been hit the hardest, with over 1,000 separate outbreaks, accounting for about 20% of confirmed cases and tragically over 80% of all deaths. Outbreaks in other congregate living and work settings are also driving case counts in some provinces. These settings include hospitals, correctional facilities, shelters, and workplaces, including Canada's largest outbreak linked to a meat processing plant. So really, in summary, the epidemiology indicates that transmission is largely under control, while also showing us that cases can reemerge anytime or place. In today's modeling update, I'll talk about how we are using modeling to identify the combinations and intensity of public health measures we need to maintain control, stamp out outbreaks, and prevent a widespread resurgence of cases. Models provide a prediction of what could happen under hypothetical scenarios, allowing us to drive our public health actions towards a best possible outcome. Just as a reminder, Canada is aiming for strong epidemic control over the course of the pandemic, with less than 10% of the population infected overall. And thanks to the commitment of all Canadians who have been following public health advice to protect themselves and others, we are well on our way down the right side of the big first peak. Unfortunately, the novel coronavirus has not been eliminated, and we do not have an effective vaccine at this time. So as restrictive public health measures are being lifted to minimize the unintended health, social, and economic consequences, we expect to see some resurgence of cases. The key is to keep the number of cases small through ongoing core public health practices. We must be able to rapidly detect and isolate cases and quarantine their contacts in order to keep any resurgence to a small and manageable size. Dynamic models are telling us that if we relax too much or too soon, the epidemic will most likely rebound with explosive growth as a distinct possibility. Modeling simulations show us that as we lift stay-at-home policies and business and school closures, we must strengthen other public health measures to maintain epidemic control. The enhanced public health measures include rapid case detection, testing, and timely contact tracing and quarantine to prevent new introductions and control any new chains of transmission in outbreak or community settings. Fast and thorough case detection and contact tracing means that cases, including any contacts that go on to become cases, will be less likely to spread infection to others. So the higher proportion of cases that can be detected and isolated early in the course of their illness, the fewer people they are likely to infect and will be less likely to spread infection to others. Likewise, when most or all contacts are identified early and placed into quarantine, fewer are likely to spread infection to others if they do become ill. So these modeling simulations illustrate the impact of rapid case detection, which is the graph on the left, and contact tracing, the graph on the right, combined on epidemic control. The faster we are, the more we drive the percentage of the population infected down. So I'm going to take a very brave attempt at taking you through a couple of these graphs. So just remember, we're trying to aim for the bottom of that y-axis, the lower percentage of people infected. So the red dot on the model on the left shows that if we detect cases within 5 days of becoming infectious, we need to reach more than 50% of all cases and isolate them to keep the epidemic under control. So keeping that dot low. The model on the right shows that if we trace contacts within 2 days of their exposure, we need to reach more than 50% of all contacts and quarantine them to keep the epidemic under control. Okay. So the graph on the left, focus on that for now. Canada has been testing more people over time, with a lower percentage of testing coming back positive, indicating that our surveillance is sensitive and casting the net wide to pick up cases. If we switch to the right-hand side of the slide, the shorter the time interval between onset of illness and lab specimen collection, the quicker cases are detected and isolated to prevent further spread. So the graph on the right shows that this time interval has decreased over time from more than 8 days to around 3 days currently. Public health authorities are monitoring the number of cases that cannot be linked to other cases as a measure of effective contact tracing, with the aim of keeping this number to a minimum. So on the graph, this is the red part. The more cases that are unlinked, that is to say we don't know how they were exposed, the harder it is to stop community spread. Lower daily case counts right now facilitates contact tracing to link cases and break chains of transmission. As society reopens, the average number of people we meet each day will increase, and there will be additional places and situations where there is a higher risk of virus transmission. These tables show different combinations of case detection and contact tracing that can keep the epidemic under control. So the colored cell shows successful combinations according to 3 modeling studies that will keep the epidemic under control. So the top table shows that with restrictive measures, school, university, workplace closure, for example, many different combinations can keep the epidemic under control. The lower tables show that with increasing numbers of contacts between people, it becomes increasingly difficult for public health to do case detection and contact tracing to control the epidemic. So there are less of those colored cells. Therefore, as society reopens and public health restrictions are relaxed, it is even more important that Canadians continue with collective efforts to maintain physical distancing and good hygiene to keep COVID-19 under control. This ensures public health capacity is not overwhelmed and can use case detection and contact tracing to control the epidemic.